Welcome back, everyone. In the last session, we talked about an aspect of the implementation of a randomized trial, and we talked about recruitment. Today, we're going to talk about another aspect of the implementation of the study, and that's going to be compliance. And we're going to be looking at that a little bit from the standpoint, not of the investigator, but actually the participant in the study. And we'll continue to use as our example the VITAL trial, the vitamin D and omega-3 trial. When we looked at our diagram before, last time we talked about the fact that we needed 20,000 people to be in the study. And we talked about it from the standpoint of the investigator, how are we going to come up with those people. Now we want to turn now to what the participant does. And the participant now is at the point where we have randomized them to receiving vitamin D or placebo, fish oil or placebo, but the participant has to comply and actually take the pills, take the intervention. And the other aspect that they have to comply with, we said that they needed to take that treatment for a long period of time, so it's not just short that they have to take the drugs, but for 5 years. And we also said that we're going to want to know about what happens to them, whether they develop cancer or cardiovascular disease. So in addition, we need them to fill out our questionnaires, report that information to us, and allow us to go get access to their medical records for those events so we can actually confirm those outcomes. And so when we looked again at our population hierarchy, last time we talked about getting the willing and eligible participants in the study, and that the investigators randomized them to either getting the active intervention or the comparison group, so active vitamin D, active fish oils, the comparison groups in terms of the placebos. But now we look at an aspect of the trial that's really very much in the hands of the participants. So regardless of what group they were randomized to, we need to find out whether they were compliers or not with those interventions. And we need to work with them to keep their intervention high during the study. So again, when we're talking about compliance, we're really talking about many different things in the study. We're talking about the compliance with the taking of the intervention, and we're also talking about compliance with the follow-up procedures, whether it be the release of medical records or whether the filling in of the questionnaires. And this compliance is absolutely crucial to the ability of the trial to demonstrate a true effect. And in fact, it is so crucial because if people do not comply with the intervention, it's going to dilute our ability to see the difference between the vitamin D and the placebo or the fish oil and the placebo with respect to the development of the outcome. And it in fact is going to bias our results so that it looks like there's no difference between the groups, even if the intervention is actually effective. So to just understand that intuitively, we have two groups in our study. We have one group that we are supplementing with vitamin D, and we have a comparison group that we are not supplementing. They are just getting the vitamin D they would usually get from the sun or with fortification of their foods. So I want to look at the outcomes for cancer and heart disease between these people who are getting a high level in their supplement and these people who are just getting a usual vitamin D level. Over time, though, people get tired. They can't comply to the exact same extent that they did at the very beginning when they were fresh and enthused. So those that we give the vitamin D supplement to, they get a little bit tired and they don't take all of their supplement. So we randomize them to have this much vitamin D, but they're sort of coming down over time, not getting quite as much in that group. This group that is just supposed to be getting the usual vitamin D and not taking supplements, well, they might read an article. They might say, you know, this vitamin D or fish oil does sound very interesting. Maybe I should just take it every once in a while. So this group that wasn't supposed to be getting supplement level of vitamin D or fish oil, in fact, starts to go up a little bit in terms of how much they got. The power of the study was to compare supplement level with usual level. Now, by the time we're doing the analysis, this group has come down a little bit in terms of how much vitamin D they are getting. This group is coming up a little bit in terms of how much vitamin D they're getting. And we no longer have groups that are as different as they were at the very beginning. And the way that not being as different translates is that the relative risk, the value that shows you how much more likely one group is to get an outcome than the other group, is not going to look as big anymore because these two groups are not as different. So we've basically just made it harder for ourselves to be able to show the true effect of vitamin D in fish oil by having two groups that do not have adequate compliance for us to really have two groups that are different from each other. And that is why, without any question, one of the main focuses of the design and the conduct of a trial is to establish and to maintain good compliance among the participants. And as a corollary of that, we actually need to be able to ascertain the compliance during the trial and be able to say how many people are actually taking the medications that they're supposed to be taking, either taking the pills that have the active ingredients in it or not taking supplements if they're in the group that's supposed to be not doing that and just having usual care. So we go about it in many different ways, and I just want to introduce you to a couple of the reasons behind some of the design features of trials. In particular, the very first one is, how am I going to give you your drugs? What can I do to make it more likely that you will be compliant with the taking of your intervention or the medication on a regular basis? And why do I even worry about this? It's because the participants in this study are healthy individuals. If they were sick individuals, ones who already had an illness, sick people are much more used to taking drugs on a regular basis. Maybe they have a methodology where they put it in a little box that has different days of the week and different times of the day, and so that can be an aid in the taking of the medication. But a healthy person doesn't take medications on a regular basis, and many people will claim, I try to take a vitamin or I try to take this and I can't remember it more than a couple weeks and then I just start forgetting it. So what can we do to help a healthy person not used to taking medications take a pill every single day? And one way that we have done it is to package it in a form that will make it easy to remember. And these are called calendar packs. And the calendar pack is actually based on the old methodology for taking birth control pills. There is a little blister pack for every day of the month. So each one of these calendar packs is 1 month. You push on that pill and it comes out the back. There's just a little piece of aluminum foil on the back. Very easy to get out. Each of the pills has a number next to it, which is the day of the month. So you can look at your watch and say, oh, today is the 23rd. Look at your calendar pack and say, oh, I forgot to take my pill on the 23rd. So it's a very easy way to remember to take them. And that calendar pack is very mobile. You can take it with us put it at work if you'd prefer, take it at home, you can travel with it. And so again, we make it easy to try to remember to take the pill on a daily basis. Just to let you know, another feature of a trial, this red capsule, for example, is either going to be fish oil or placebo. And I am blinded to whether that pill is an active agent or placebo. The participant, when they get their calendar pack, does not know whether it's an active agent or placebo. So the participant is blind, and I'm also blind as an investigator, so it's double blind. We absolutely can unblind in a moment's notice if a physician of one of our participants needs to know what the participant is taking. Very easy to unblind. But on a regular basis, so that we minimize bias when we're asking the participants about side effects or other events that are occurring to them, it is a much better way to do it, a much more valid, unbiased way to do it, to be asking them about their experience without either me nor they knowing what active or placebo agent they are on. The other thing to notice is that we put it in an aluminum pouch. And that is because we are going to be sending these calendar packs all throughout the United States, to places that are very hot and very cold, to places that are very humid and very dry. And these capsules, any medication can be influenced by the conditions in the environment. So by putting it in this aluminum pouch, the participant can actually store it in the pouch until they're ready to use it, and then take it out for the month that they're going to take it. And the other thing just to notice how expensive these calendar packs are. They can be a couple dollars per calendar pack. And we're going to be having 20,000 people in our study over a 5-year period of time, and they get one of these every month. So it is a big expense, part of our budget. But on the other hand, pilot studies have shown that it really helps compliance. It helps the participants remember to take the pills. And that will then increase the validity of the findings, and it will be money well spent to be able to increase the validity and the assuredness of the results of our study. What else can we try to do or recognize could be a problem when we're talking about compliance? We have found that compliance goes down the more that we ask of the participants. So we have to think very carefully about what is the burden that a participant will have in a study like ours. One thing, of course, is to take a pill every day. But in addition, what else are we going to ask from them? So we actually always try to map out for any particular study, how many questionnaires are we going to be asking them? How long will it take to fill out that questionnaire? Will they need to come into the clinic? If so, how long will that take them to do? And really get a sense of, from a participant standpoint, will they get tired of what's being asked of them, or will they say, yes, this is reasonable, this will be worthwhile, and I am willing to do this to answer the question? So in the parent trial, the VITAL trial we're talking about, it takes about 3 hours to do the screening questionnaire and all the questionnaires that are in the first year of the trial. Then in year 2 to 5, we just do follow-up questionnaires. And each one of those follow-up questionnaire only takes about 30 minutes. About a half of an hour to do. So that won't be bad at all during those years. So that over time, for the 5 years of the trial, the entire filling out of questionnaires, that have very simple, straightforward questions, but there are many questions that we need information on, will be from 5 to 6.5 hours. If any of the participants are in an ancillary study, one of the studies that Joanne Manson talked about at the very beginning, where we are building on some additional things. For example, you respond that you have knee pain, so we might be doing an additional study looking at knee pain. Then you will have less than an hour a year where you will have to do some additional questionnaires to be in one of those ancillary studies. And finally, if you're in the special component, more intensive component of the VITAL trial, where you actually go to a clinic setting, it's called a CTSC activity, then you come in for testing. And that testing will take between 1 and 1.5 days at baseline, and then in year 2 it'll take the same amount of time, but the participant would be compensated for the time that they are taking to do this. And finally, we need to really participate. We need to interact with the participants as often as we possibly can. And we do it in many different ways. We do it by having a website where we can put up information on the study, where it currently is, new things that are happening in the study, and a participant or anyone can look at the website at any time. In addition, we put out a newsletter that we send along with their study medications, with those calendar packs. We do that twice a year. We have pictures of participants so that people can get to know each other, even though this is a study where none of us actually meet each other in person. We talk about questions and answers. We talk about news stories in science that are relative to what we're interested in looking at, and we talk about them when we interpret them in terms of the meaning for the participants. And in addition, again, because this is done completely by mail, we get a tremendous amount of phone calls or letters from the participants, each of which we answer, so that we can answer individual questions. If we don't know the answer, we make suggestions as to how they can get the responses. And above all, what we want to do is make it feel that we're basically a family, that the participants plus us are in this together to make this trial a success. So I think that the last thing, that after we establish the compliance, is that we have to maintain it over time. And then we have to ascertain compliance. We need to know whether the person actually takes the pills or not. So to do that, our primary way of doing it is having them just self-report their compliance. So on the questionnaire we say, for each study capsule, please describe your compliance during a typical month since we have last written to you. And then tell us if you're non-compliant, why not? So that maybe we can help you. If the participant is saying, I just can't remember or it is difficult to do it in the following way. The pills are just difficult to swallow. We can give suggestions. You take it with food, you try putting it in the following locations. We can actually work with the participants to maintain the compliance. And then finally, we do a little validity sub-study where we take a small group of people, we measure their blood levels of the agents we are testing, and we look at what their blood levels say against how they reported to us whether they were taking their medications. And what we found is, in other studies, that not everybody is perfect on the compliance, but they seem to be willing to tell us, self-report to us when they are being non-compliant, which means that it makes it very easy for us to use self-report as our measure of compliance in our trial. So in summary, when we talk about compliance, from the standpoint of the participants, compliance is one of the most difficult aspects of the trial, but we are so aware of that. And from the standpoint of the investigators, compliance is one of the most crucial aspects of the trial. So for the participants and for us, there's going to be a tremendous effort on the part of everyone throughout the conduct of the trial to work with the participants so they clearly understand that the trial's success hinges directly on them. That we, the investigators, can have a truly wonderful, meaningful, important question to be answered. That we could have designed it well and we could have gotten funding to do the study. But if the participants are not willing or able to maintain their compliance and work with us in terms of taking the intervention and doing the follow-up, then this trial will not be a success in terms of answering the questions it was set out to answer. Thank you.